Hi, my name is Bob Taylor. I'm your host for today's segment of Our Ventura TV. I'm here today with my guest, Commander Stewart from the Ventura County Sheriff's Office stationed in Camarillo, and Rabbi Aryeh Lang from the Chabad of Camarillo. And our segment today is all about Saving Lives Camarillo. All right, Mr. Stewart, I'm going to start with you, Commander. Why is the police department involved with a nonprofit?
In this situation, this nonprofit, we deal with prevention, drug prevention in our community, with our youth and with the citizens of the community, and I just believe it goes hand in hand with the mission of Saving Lives, along with what we do in law enforcement to try to prevent drug abuse and the issues that come along with drug abuse.
Okay, great. Okay, Rabbi, Saving Lives Camarillo. Now, I know that is a Camarillo little nonprofit, but it's not just something that just started for Camarillo. Why don't you give me a little bit about the background of the nonprofit itself?
Sure. We're actually started in 2009 in Camarillo, and we were awarded a grant, our coalition, federal grant in 2010. It's the Drug-Free Community Grant, and we're one of over 700 coalitions nationwide that really serve their local population and try to prevent drug abuse amongst the middle school and high school age kids.
Okay, so any cities can apply for that grant and start their own little drug saving program or working with kids program?
Absolutely. Any city can do that.
And it's not regimented to exactly how you have to run your drug program?
Absolutely. There are definitely codes, rules and regulations of how you have to follow the grant, but anyone, and I encourage anyone to do that, because we all know that drugs and alcohol is a problem within every community, and here it's a great program that allows for each community to try to deal with their problems locally, on a local level.
So every community can do it a little bit different than you do?
Absolutely, and that's the whole beauty of this program, that the government is not telling you what to do, it's helping you and the people of the community solve the problems within the community.
Okay, great. Now, drug abuse and alcohol abuse and that kind of thing is such a wide range. What do you guys focus on? I mean, it's hard to say we're going to grab this whole thing and run with it. So what do you focus on more than anything else?
Well, what we do, we start off with a needs assessment within the community. We looked at the California Healthy Kids Survey and the data from the police department, law enforcement, and we looked throughout the community to see what are the issues within our community itself. And we found that the biggest problem was alcohol. Then the second was marijuana. And after that, prescription, and the big new one is the prescription drugs and over-the-counter drugs that kids are getting a hold of. I think it even eclipsed right now the death toll from car crashes right now for the first time, death through prescription drug abuse.
Now, I hear a lot of things about prescription drug abuse, a lot more now than I used to in the past. Is that something that's on the rise?
Absolutely. Like I said, it just eclipsed the death from car crashes amongst youth, over-the-counter and prescription drug abuse. So that's definitely a big and we are focused on that right now as a coalition. We're looking at prescription drugs as one of our goals to try to reduce in Camarillo. All
right, Commander. Now, how does I do know your job, of course, is almost the same as what the coalition's is.
Yes.
But how does that work together in the nonprofit world? I mean, you're going out there busting people. They're not finding them when you're going out and busting them. You're working together to try and make this work as a prevention thing.
Exactly. Well, I think in order to be effective, you always have to have kind of a multifaceted approach.
Yes.
And on one side of that is enforcement, and that's very important. But on the other side is also education and prevention. Because if we can take care of a problem on the front end, it's much easier and much more beneficial to the community than taking care of it on the back end through enforcement. But it's a collaborative approach, and the police department can't do it by ourselves. We need help from the community. We need help from the private organizations to be successful, and to get the message out there about the dangers, especially with prescription drugs. Right now, as far as the danger of prescription drugs and their amazing availability, that really anybody from children in our homes to would-be thieves have access to prescription drugs, and that's what we're trying to prevent.
Okay. All right, Rabbi, now what are some of the things you have done? You put on a little seminar for doctors at one time, and what other things have you done in Camarillo to work towards your goal of making people aware of the abuse of the things you talked about?
Well, I think I need to backtrack here and tell you a little bit about the approach that we take.
Okay.
The approach is environmental prevention. So the best example I can give, if you're on a boat and there's a hole in the boat, so you can try to get a bunch of life-saving jackets for everybody and give them jackets. It's very expensive, and every person needs to be given a life-saving jacket. Or you can just kind of stuff the hole, and then you're doing much better. So or another example would be if it's cold, you can try to buy people sweaters, or you can buy a heater and everybody becomes warm. Environmental prevention looks to change the entire community that you live in. If you reduce access, for example, of drugs and alcohol, so then automatically you've affected everybody in the community. So we've taken our coalition, and the coalition is made up of 12 sectors. It's professionals, law enforcement, business professionals, government, physicians, parents, and students that are part of this coalition. It's like a think tank. We meet every month, and the whole idea is we create an action plan of how are we going to go about reducing the access to the alcohol, the access to the drugs within our community. So we've focused it into 3 subcategories. It's, we call them task forces. One deals directly with youth, one deals with parents, and one with the business community. So what you talked about, the seminar that we put on, one of the ways that prescription drugs gets to people is through physicians and pharmacists. So we put on a seminar. We actually, we're doing one right now. We're putting on another seminar. We do that. We try to do that every year. And they get credits, the doctors, for coming to our seminar.
Great.
Where we'll have
big encouragement.
Big encouragement for them. So that, and we'll have a law enforcement, the representative, that will talk about doctors that have gotten in trouble, and then we'll talk about different ways that they're all well-meaning, most of these doctors, and 99% of them, but how can they prevent and make sure that they have the right conversation with their patients and prevent it from becoming a legal prescription to getting to the hands of a young teenager.
Right, makes perfect sense to me. Now, I hear a lot about alcohol abuse and marijuana abuse, drug abuse itself, but I don't hear an awful lot so much about the prescription pain medication until recently. I read somewhere that Vicodin is the #1 abused prescribed medication and being way overprescribed and that kind of thing. What groups do you turn to? Like we talked about earlier, caregivers, realtors, the ones that are seeing those things when they're in housing. What other groups are there that can really help, and how can caregivers help you, and realtors, those kind of groups, when they're in somebody's house, that kind of thing?
Yeah.
Go ahead, Rabbi.
Okay. Well, I would say the first thing is that we like to encourage everybody to actually lock up their prescription medication and be aware of what they have at home. A lot of people don't know. They come to you should know what you have in your closet, and people should even know and should lock it up. Just like if you have something dangerous, you have a gun at home, you lock that up. Right. So this is no less dangerous, and everyone says it can't be my child, it can't be but you know what? It's better to be more cautious. And even if it's not your kid, how do you know your kid doesn't bring someone else over to the house that might snoop around in your medicine cabinet? So that's a very important thing, I think, that we try to encourage parents to.
And I think just the sheer fact that we're talking about it, we're here today, we're talking about it, we're telling people, hey, remember what's in your medicine cabinet. We've all been there, we've all been prescribed medications before, and I bet a lot of us could open up our medicine cabinet and you have medications that are 2, 3, 4 years old in there. And so along with that is be aware that it's in your medicine cabinet, be aware it's probably expired and that you need to get rid of it. And as in Camarillo, people can bring it to the Camarillo Police Department. We have a disposal bin that you can take prescription medications that you no longer need, and you can put it in that bin and dispose of it for free. We don't encourage people to throw it in the trash, put it into the sewer system, but actually throw it away, and we'll take care of it for that. But it's a matter of just educating people and letting people know this is a problem, and there's ways to take care of it. And that's the great thing about the coalition, is getting that message out there.
Now, generally, and please correct me where I'm wrong, you guys know this more than I would, but if you hurt your back, you get a toothache, those kind of things, the dentist will give you a couple weeks supply of some kind of pain medication, or the doctor will give you a couple weeks supply, and quite often only 3 or 4 days is needed. Now, personally, if I pull a muscle and I get some pain pills and take 3 or 4 of them, they're going to go back in my cupboard for next muscle that I pull, so I don't go to the doctor. That's probably not a good idea, is it?
No, I don't think it's a good idea at all, because you really should, each and every time that you're injured, you need to consult with your physician to make sure that you're on the right plan and that you're being prescribed the right medications. And that's one of our issues that when we talk about in the business portion of the coalition, is when we bring pharmacists, we bring doctors in, is do we really need to have those large amounts of prescriptions that are given, like a 30-day prescription, versus maybe we just need a 5 to a 10-day prescription, and then we can avoid that. But each and every time, you should always consult with your physician to make sure that you're taking the right medications for the injury that you have.
Now, speaking from a layman's point of view, I might not know this, and you might not either, but is it just as easy for a doctor to prescribe 5 pain pills as it is for him to give you a 30-day supply or that kind of thing? And I've never nobody's ever given me a 5-day supply. I've gotten 2-week supply before when I've gone in with a bad toothache or had some work done or root canal, that kind of thing. But it's usually a couple of weeks, and sometimes just 4 or 5 days is enough, like you were saying. Yeah,
absolutely. And again, I think it's just a matter of also educating the medical community, too, about the dangers, about the excess amount of prescription drugs that are out there. They can prescribe really any amount that they choose to, but it's a matter of convenience. And sometimes in this situation, when we have these drugs out there that are actually damaging the community, leading to deaths, convenience isn't the best option out there, so we should make it a little more inconvenient for people.
Right. No, I agree. All right.
Just one more thought, if I could add. I think that the majority of doctors are really professionals and looking for the best of their patients. I just think that sometimes, like was said by the commander, that it's prescribed and used for the wrong thing, so we just have to do what we can to stop that.
I got to admit that in the past I've been guilty. Had something for a toothache, and then pull my muscle in my back and take them for that. All right, believe it or not, we're actually running out of time. We're down to less than 2 minutes. What kind of points do you want to get across? I mean, you got to talk about your website. We want to get people involved. We want people to be able to start their own thing. How does somebody start, and where do they go to do that?
Well, first of all, our website is savinglivescamarillo.org. We meet once a month, the last Tuesday of the month. You could call 805-383-7882.
Let's do that one more time, just a little bit slower, just so everybody gets a chance to get a pencil and write that down. This is very important for everybody that's listening.
It's savinglivescamarillo.org, and the phone number is 383-7882. That's 805 area code. And we meet once a month, the last Tuesday of the month, usually at 5:30 till 6:30 p.m. And we encourage everyone, you don't have to be a professional to make a difference in your community. You just only need to have a desire to make a difference. And, if there's a hole in the boat, everybody goes down. That's the way we got to view our communities. If one kid is abusing drugs, then it's all of our collective responsibility to make that difference. It's not about whether it's my child, the other person's child. We all have an obligation to care for each other on this planet. And I think we're seeing more and more about that. If there's one problem child, we're all going to get affected by that. A crash in a car will affect from substance abuse. We also do things in the schools. Red Ribbon Week, very involved. We bring speakers to the high schools. We do social norms programs. And social hosts, you're not allowed to have a party and where there's alcohol within youth are drinking alcohol, you get fined by the law enforcement. It's called the Social Host Ordinance, which is Ventura County Behavioral Health was very involved with setting that up in Camarillo. People need to be aware of these laws, and this is how we environmentally change our community. And even if we save one life, we save the world.
Okay. Now, so anybody at all can get involved. They can call you for other communities to call you and get their information.
Absolutely.
All right, great. We've run out of time. Really want to thank you guys for being here. Thank you very much, Commander Stewart, for being here. Thank you, Rabbi Aryeh Lang, for being here. And what a great nonprofit this is. I really learned a lot. And if everybody follows what you're doing, that could really be a great thing for us.
Thanks for having us.
Well, our time is up. I really want to thank you all for being with us. We've had Commander Stewart with us today and Rabbi Aryeh Lang from Chabad of Camarillo. And my name is Bob Taylor. This has been our segment on Saving Lives Camarillo. Thank you all for being here, and thank you all to our sponsors. Until next time, have a nice day.